folks, and welcome back to another episode of Monday Medline, where we consolidate all the happenings in the medical world and get you the best of this world to help you make an informed decision. So, starting off with a sensational one, a recent study from the University of Australia suggested that boys born to an obese mother might be destined for a bumpy health ride in their adulthood. Researchers stated that the male offsprings of these moms are more likely to tip the scales at birth and encounter a metabolic speed bumps like liver diseases or diabetes. The study reveals that when female fetuses exposed to a surplus amount of testosterone from an obese pregnancy cleverly hits the brakes on the androgen pathways in liver, this strategic move restricts their growth and increases the risk of metabolic disorders in adulthood. Apparently, if there is an excess of these androgen male features grow larger than life, not just causing a stir during childbirth but also setting up stage for an adult liver issues. If kids knew early on about the joy of munching on veggies, it would stick with them until in their adulthood, even during pregnancy, when the right nutrition is the real way to go. This is a wake up call for our society to re evaluate its love affair with unhealthy munchies. Understanding how maternal obesity affects fetal developments shed light on the importance of a balanced lifestyle, not just for an expected mother, but on a society as a whole. Now, staying in the same topic of kid and wellness, and from the topic of antibiotic resistance that we had discussed recently in this forum, a health shocker straight from the heart of Telangana, a recent report spills the beans on the state's love affair with antibiotics, especially when it comes to our little ones. The Osmania General Hospital takes a spotlight, showcasing an eyebrow raising 89% antibiotic prescription rates in pediatric cases and a solid 70% in the intensive care units. According to the report, Telangana has a whopping 65.9% prevalence of antibiotic usage and an overall 89% antibiotic prescription in pediatric cases, ringing the alarm bells. The report waves its finger at the three categories, which is known as assess, watch, and reserve, where assess is a class of antibiotics which are the first choice with a narrow spectrum, fewer side effects, and lower potential of resistance. Watch are the categories of antibiotics used in sicker patients in hospital, and they should be monitored to prevent the overuse. And the reserve care of antibiotics or the categories of antibiotics are those that has to be unleashed in a case of a severe infection caused by a multi-resistant or drug-resistant antibodies. And this report suggests that the watch categories of antibiotics are sold at a whopping 55% against the WHO's modest 40% of recommendation, neglecting the old so called access or assess categories of ones. And if we keep up with this pace, we are in fast tracking antimicrobial resistance. And in rural Indias or the rural areas of the same region, reserve drugs are distributed as candies. Overusing antibiotics isn't just a Telangana issue. If we continue down this path, our drugs might sooner or later become useless as an umbrella in tsunami. So let's put the brakes on the antibiotic overdose and save these life-saving drugs when we really need them. Your health and health of your future depends on it. And talking about breakthroughs, in a dental delight of scientific breakthrough, two brilliant minds from Puducherry, Dr. U.R. Anup and Dr. Kavita Verma, have cracked the code on a quickery methods or routes to administer drugs to the brain. Now, the head of neurology at Indira Gandhi Government General Hospital, Dr. C.T. Suresh, teamed up with Dr. Anup and Kavita to pull off a jaw-dropping feat. During a routine dental procedure, specifically a root canal treatment, they decided to administer levodopa, a drug which is used to treat Parkinson's diseases, to an 80-year-old gentleman in Puducherry. The drug took a detour through the tooth. This route of administration was more effective in managing Parkinson's compared to the regular methods. Levodopa is used in treating Parkinson's diseases, but the usual oral route has its hurdles. A whopping 70% of the oral dosage is lost in the gut, and only 1% crosses the blood brain barrier to do its magic. Well, apart from levodopa, the other treatment options which were available today are deep brain stimulation or intestinal gel pump therapy, which are basically an inpatient procedure. And this outpatient procedure is more promising, and the patient zero looks and shows improvement for this novel route or this novel method. This breakthrough opens door for less invasive and more affordable treatment options for neurological disorders, and that's a game changer from the medical world. And staying with innovations in India, All India Institute of Medical Sciences New Delhi have unleashed an AI platform, ioncology.ai, to tackle cancer. On the backdrop of a study published in Lancet, which had warned us that cancer cases in India are set to spike by 57.5% in the year 2040. In 2022 alone, over 8 lakh souls have been due to cancer due to its late detection. All India Institute of Mental Sciences, or AIMS, is in cahoots with the Center for Development of Advanced Computing, CDAC, Pune, merged ioncology.ai, an AI wizard that aims to spot cancer before it unleashes its havoc. This platform has a deep learning model soaking up all the clinical and imaging data and suggesting the changes that might get unnoticed from the eyes of a health professional or a healthcare doctor or through any blood culture or any of the reports. Early detection of cancer drives the survival rate up by 80% or even higher in some cases. But manual diagnosis sometimes might lead to false positives or false negatives. And that is where AI comes to rescue as it significantly slashes these chances of missing the cancer. This platform is designed to tackle breast and ovarian cancers as of now, and the platform's user friendly design and a spot on accuracy had the experts nodding in approval. Now, AIMS is eyeing more partners aiming to spread the AI magic to cancer hospitals across the country. Artificial intelligence is not just an advanced tool for using or diagnosing diseases like how we see in cancer, but these tools and innovations are happening in health sector across. Like artificial intelligence is putting on its surgical gloves and making waves in the realm of neurosurgery. It's not just about the flashy tech, it's about the safer surgeries, snappier recoveries, and a smarter approach to tackling brain related changes and challenges. In a country with a health sector that is growing fast, the integration of AI into brain surgeries is like adding a dash of spice into your dish, and it just makes everything better. Brain surgeries, whether for tumors, epilepsies, or injuries, are no walk in the park. The potential benefits for a patient's quality of life are massive. So, what's all the fuss about AI in brain surgeries? Let's break it down and try to understand the intricacies of AI and how it has changed and challenged the entire ecosystem. Imagine this: before the surgeon even picks up a scalpel, AI is already at work creating a 3D model of the patient's brain. It's like the GPS of surgeries, guiding the surgeons with labeled areas for speech and hand movements. This pre-op planning dance ensures the surgeries are safer, more effective, and minimizes any unintended harm to essentially brain zones. Intricate brain surgeries require steady hand and a dash of AI magic. Picture an AI powered navigation system that's not just keeping the tabs on surgical instruments but are also doing it in real time, providing immediate feedback to the surgeons. It's like having a trust sidekick helping the surgeons dance through the complex structures of the brain with confidence and grace. Well, AI isn't just a sidekick, it's a detective tool too. By analyzing heaps of data, AI can spot subtle brain abnormalities or changes, and any kind of change the human might have missed. Early detection means early action, so catching the tumor or the degenerative lesions or aneurysm in their infancy, leading to better treatments and improved patient outcomes. No more one size fits all as a solution. AI is bringing personalization to the forefront. Doctors can now craft tailor made treatment plans by diving deep into individual patients' data from genetics to health metrics. It's like a bespoke suit for your brain, ensuring better surgical results and minimizing the risk and also improving post surgery or post surgical recovery. AIs aren't just clocking out after the surgery, but it's sticking around for the post game analysis, real time data on brain pressure, blood flow, and neurological conditions are analyzed to spot early signs of trouble. It's like having a vigilant guardian ensuring a smoother recovery and reducing the risk. Plus, AI predictive power help doctor anticipate the outcomes, refining long-term care plans for patients with complex neurological needs. Now, why should you care about this brain tech revolution? Because brain surgeries, once a daunting journey, are getting a tech-savvy makeover, promising a safer procedure, quicker recoveries, and a brighter future for patients. Sure, there are challenges like doctor needs superhero level training in a wield these AI tools effectively. Concerns about data privacy and algorithmic biases are real, but march of progress is relentless. Ongoing research, technology, leaps, and collaborative efforts are pushing the boundaries of neurological care and its surgical applications in India. And that's the wrap on this edition of Monday Midline. We have dwelled into crucial health updates and insightful topics. Now it's your turn to join the conversations. So share your opinions and thoughts on the issues we have covered today. And stay tuned for more exciting updates coming up next week. Don't miss out on the latest news and insights as you hit the subscribe button. Make sure to hit the bell icon as well to stay informed. Your engagement fuels the heartbeat of Monday Midline. So until next time, keep exploring the realms of health and well being with us. Remember, your health journey is our priority. Take care, stay informed, and we'll catch you in the next edition of Monday Medlines.